Thanks again, Dr. Ferrada, for talking to the Op Report. You are Latina, female, you speak with an accent. You may have run into some of the sort of stereotype problems that this I Look Like a Surgeon campaign is making an effort to overcome.
Thank you, Chris, for having me. Yes, we both have talked about the opportunities in breaking stereotypes. As I had said before, I think this is not a problem that is unique with surgery. I think is a problem with society. I think that's why I Look Like a Surgeon had such a great success because it put in words what people were already thinking.
Mm-hmm.
I think change is happening, and it's up to all of us to make it better and start judging people for who we are and what they can do and your outcomes and your results rather than how you look like, and it will come with time.
Yeah. So tell the viewers about the other day when you were in the doctor's lounge.
So, so I was in the doctor's lounge and I was serving my own food because I was in a rush to go to the OR, and also because I don't like people serving me. And the lady that serves the food was out, and I just needed to go. And then an intern that came with an attending, I guess, because he wanted to be nice and pay for his food, asked me, "Hey, can I have some chicken?" And I'm like, "Oh, yeah, I would serve you, only I have to run to the OR." And I could see the attending's face that he was so embarrassed, and then the intern kind of looked at me in the face straight, and I didn't feel bad, because you know what, every job has their importance, and I think the job that the lady that serves the chicken is great, and yes, I'm small and look young, and I'm Latina, and I was wearing scrubs, so I could be the person that serves the chicken. It's not a big deal. But in his mind, he will think twice before he judge somebody again because of those issues.
Right.
So that doesn't make me feel bad. In fact, I took it with a little bit of humor. I love to be like the undercover surgeon that people have because I think it. But I don't. I think we're at this point in history where the person that should feel bad is not the person that is overlooked, but the other person that is overlooking, I think. And
Right.
I think those
Right.
kind of those are opportunities that teach us all. And then we talk about with families multiple times. I have people telling me, "You're too young to be the surgeon," and I think now, it used to make me upset when I was young. Now that I'm getting closer to 40, actually, I think it's great that they think I'm too young. But I think I am blessed that I'm a trauma surgeon, acute care surgeon. So I always meet people when I'm the last resort for life. So I think even if they say it or they think it, at some point because of circumstances, they have to trust me, and then is because of my results and my outcomes that they have the opportunity to judge me. So most of the time when that circumstance has happened, I end up having friends with the family forever, and see my patients go through and have a good outcome. So
Yeah, so your outcomes and your relationships are helping to dispel those stereotypes, perhaps.
I think everything is how you take it. I think I agree that we have issues with stereotypes, and I think that those issues with the stereotypes are stronger with gender and ethnicity and different ethnicity and youth. But I think also culture is changing, and it's up to all of us to do something to change that.
Yeah. Hey, tell me what happens. Tell me what happens when you go to the bedside with a big, tall male medical student.
Oh, it has happened multiple times that they talk to him because he's the doctor. But it takes time. But patients quickly find out who's the person in charge. I don't take it as a personal offense. It's not. I mean, it's changing. They're going to change their mind. Older people are going to take longer to understand that a surgeon can be a woman, a surgeon can be African American, Latina with an accent, and that we might be in scrubs all the time, not necessarily with like super dressed up like other physicians that have the time. But it's okay. It's going to take time, but we're going to get there. And I don't think this is unique of surgery. That's why it started with I look like an engineer, because stereotypes that are in society are everywhere.
Yeah, I'm glad to see this burst of social media activity, and I think I think it'll be helpful for people to see what surgeons look like. They can look like anything.
Absolutely.
Thanks for talking to us again today, Paula. Dr. Ferrada.
Thank you, Chris.
Bye-bye.
Bye.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.